Hello to Miss Pet. Today our group will present about muscular endurance. First of all, my name is Nurlaila Zafira and my group member Jessica Josue and Muhammad Fajri bin Fateh. Okay, definition. What is muscular endurance? Muscular endurance is the ability of a muscle or a group of muscles to perform repetitive contraction against a pose for an extended period of time without getting tired. The greater muscular endurance, the higher number of repetitions could be complete. Okay, next, there are three types of muscular endurance. Test 1, 1 minute setup test. Test 2, 1 minute pull-up test, and test 3, 1 minute push-up test. Okay, I will explain about test 1, 1 minute setup test, and Muhammad Fajri bin Fateh will explain 1 minute pull-up test, and Jessica Josue will explain 1 minute push-up test. Okay, test 1, 1 minute setup test. What is setup? Setup is a classical abdominal exercise done by lying on your back and lifting your torso. Use body weight to strengthen and tone the core, stabilizing abdominal muscles. What objective for this test? Objective for this test to measure the endurance of the abdominal muscle and hip flexure. Okay, this is equipment for 1 minute setup test. First, as we can see, this is the flat and clean surface, and then stopwatch, record sheets, and then pen. Okay, 1 minute. This is pre-test. 1 minute setup test procedure. First, explain the test procedure to the subject to avoid the subject doing wrong while doing the test. And then second, perform screening of health risk and obtain informed consent. And then pre-perform and record basic information such as age, height, body weight, gender, and condition. And then the last, perform a standard warm-up to reduce injury while during the test. Okay, next test. The knees. Step 1. The knees bend at approximately right angle with feet flat on the ground. Step 2. The hands should be resting on the knees. Push your back flat. And then step 3. Push your back flat and rise high enough for your hands to slide along your thick to touch the top of your knees. And then the last step, repeat as many times as can in 1 minute. Okay, do and don't during doing the test. First, the do, we must sit up straight and upright. Sit up, straight and upright. Keep lower back on the floor, feet flat on the floor. And then do not cross your leg. Do not place the hand behind the neck like this, and then do not slouching. Okay, as we can see, this is norm based on the amount of doing the setup in 1 minute. We see here this is age, and this is the level of this norm, which is for example, for this age around 18 to 25, the excellent above 49 time doing 49 doing the setup in 1 minute, and then the very poor below 25. So this is the norm for this test. Yeah, and then this is norm for women based on the amount of doing the setup in 1 minute. As we can see here, this age around 18 to 25, the excellent is above 43 and very poor below 18. Advantage and disadvantage. Advantage for this test is required minimal equipment. We just need a stopwatch, record sheets and a pen, and we can do anyway as long as the place flat and clean, and very important, the place is very safe. And then it is a simple test to do. It's very simple. Yeah, very simple. We don't need more equipment. Yeah, and then this test is low cost for equipment. Yes, we know that. And then large group may be tested at once, because we can do anyway, and we can test large group at once. And disadvantage is difficult to determine if correct setup is performed and require assistant to administer the test. So that's all from me. We move to the next explanation, and thank you for listening.
Let us moving on to the next test. The next test is 1 minute pull-up test. So what is it? The pull-up test, also called the chin-up test. Subject must grasp an overhead bar and pull up the body so the chin rises above the bar, then return to the position with the arm fully extended. Objective of this test is to measure the arm and shoulder muscular endurance, along with our upper body muscular endurance. So this is the equipment for 1 minute pull-up test. As we can see here, the overhead pull-up bar, the stopwatch, pen, and the recording sheets. So this is the 1 minute pull-up test procedure. The procedure might be slightly different from the other tests. As we can see here, it also measure and record the height of the bar. So firstly, the tester, the trainer, should explain the test procedure to the subject, and then performing screening of health risks and obtain informed consent, and prepare, form, and record basic information such as age, height, body weight, gender, and condition. And then the tester may measure and record the height of the bar. And lastly, the subject can perform a standard warm-up. So this is the step to do the test, the pull-up test. Firstly, The subject must grasp the pull-up bar using either an overhand grip, which is the palm facing away from the body, or the subject may use underhand grip, which palm facing toward the body with the arm fully extended straight to up. And the next step is subject then raises the body until the chin clears the top of the bar, and then lower again to a boost position with the arm fully extended. This will be counted as one pull-up. So the subject may repeat as many times as he or she can in 1 minute. The do's and the don'ts for the pull-up test. Subject should be within reach or slightly higher when doing the pull-up. He or she might keep the shoulder down and back while doing pull-up. Squeeze the back. The subject should squeeze the muscle. Should feel the squeeze on the back muscle. And they shouldn't do jerky motion, swinging the body, or kicking or bending the legs, as it is not the correct ways to do the pull-up test. So as we can see here, it is the norm for 1 minute pull-up test. The norm based on the amount of doing pull-ups in 1 minute. If men of age 20 to 29 can achieve more than 10, and he will get an excellent for that. Okay, this is the norm for the woman. So we came to the advantages and disadvantages of the pull-up test. So these test equipment are easy to prepare, and it is the most effective test to measure the muscular endurance, as it involves the amount of muscle contraction during using the test with our upper body muscle. So the disadvantage, the subject might feel pain and discomfort while doing this test, as their body weight influence the subject ability to do the test. The heavier the person is, the hard for them to do a pull-up. So only one subject can be tested at once, rather than the other tests, which a large group can be done at once. So the last disadvantage of this test is it requires high strength to do a pull-up. For one who didn't have the strength, might not even do a single pull-up. So that's it from me. Thank you. Let us moving on to the next test.
Hello everyone, my name is Jessica Joshua and I will continue the presentation. Go 1 minute push-up test. Push-up is the perfect exercise that builds both upper body and core strength. This exercise uses muscle in the chest, shoulder, tricep, back, abs, and even the legs. The objective of 1 minute push-up test is to measure the upper body and abdominal muscular endurance. The equipment for 1 minute push-up test is number 1, the flat and clean surface. Number 2, the stopwatch. Number 3, the recording sheet. And lastly is the pen. This is the 1 minute push-up test procedure. Number 1 is the tester must explain the test procedure to the subject. Tester must give the same test procedure to the subject. Number 2 is the subject must perform screening of health risks and obtain informed consent. Number 3, the tester prepare form and record basic information such as age, height, body weight, gender, and condition. Last, before the test start, tester must make sure all the subjects do the standard warm-up. This is the step to do push-up test. Number 1 is press yourself up with arms fully extended and lower yourself back until your chest is a few inches from the floor. Rest only in the up position if necessary. Repeat as many times as can in 1 minute. In the 1 minute push-up test, yaitu do's and don'ts. In do's, the subject must keep the body straight and keep the head in the line. For don't, the subject do not drop the belly or the hips, and subject do not let the nose or head touch the ground first. For your information, in this test, there are 2 types of push-up for women. One is the normal push-up and second is the woman push-up modified. The woman able to choose which one types of push-up that they want to use, whether the normal push-up or the push-up modified. Okay, for the push-up modified, step to do is kneel on the floor, hand on either side of chest, and keep back straight. Lower the chest down toward the floor, always to the same level each time. Your elbow is at right angle on your chest, touch the ground. Repeat as many times as can in 1 minute. This is the norm 1 minute push-up test for men. This norm based on the amount of doing the push-up in 1 minute. Okay, let me see. At the age 17 to 19 years old, the excellent is 56 or more. For the age 60 plus, the excellent is 30 or more. But very poor for the age 17 to 19 years old is 4 fewer, and for the age 60 plus, very poor is 0. This is the norm 1 minute push-up for women. norm based on the amount of doing the push-up in 1 minute. At age 17 to 19 years old, the excellence is 30 or more, and age 60 plus, the excellence 12 or more, but very few for all the age is 0. This is the norms for 1 minute push-up modified. This is norms based on the amount of doing the push-up in 1 minute. At age 17 to 19 years old, the excellence is 35 or more, and the age of 60 plus, the excellence is 23 or more, but very poor for the 17 to 19 years old is 1 and fewer, and age 60 plus is 0. The advantages and disadvantages for the 1 minute push-up test. We go to advantages first. The advantages for the 1 minute push-up test is easy and quick to perform. Second, large group may test at once, thus require minimal equipment. The disadvantage for the 1 minute push-up test is, after the test, the subject may back pain, or second, elbow injury, third, wrist pain. In the conclusion, muscular endurance is a key component of physical fitness that is associated with improved quality of life and with many health benefits, especially those associated with strong muscle, bone, tendon, and ligament. Thank you.